Hello, everyone. I'm Mayor Paulette Guajardo, here to provide you with a COVID-19 briefing. First, I want to acknowledge our community partnership with Driscoll Children's Hospital. We've teamed up with them to be able to vaccinate more people, as you've heard, and Driscoll Children's vaccination drive will also be held tomorrow, Thursday, February the 11th, at American Bank Center. Registration for this clinic has already closed, but they will conduct the drive tomorrow. And it's very important everybody understand that strong and strategic partnerships such as this one, these are examples of how the public and private sectors can come together to work for you and vaccinate as many people as possible, because we couldn't do this alone. Let's talk about our first and second dose clinics. So our first and second dose clinics have been held are being held at the Richard Borchard Fairgrounds. Yesterday, the City County Health District hosted a first dose vaccine clinic for 3,000 patrons at the Borchard Fairgrounds. And we were able to administer those 3,000 vaccines in 6 hours. So that between the hours of 8 a.m. and 2 p.m. So that was about 500 vaccines every hour, which is just, it's wonderful that we're able to do that. And we're very proud of our team, and we thank all of the volunteers and those that are helping us achieve this. I think it's a bold achievement by our City County Health District and the staff and volunteers. Let's go ahead and move into our second dose clinics, which are being held today, Thursday the 11th. And at Richard Borchard as well. So if you were vaccinated on January 11th, 12th, 15th, or 16th, then it's time for your second dose. So the first clinic, as mentioned, was today, and it started at 8 a.m. The second clinic will be tomorrow, and it will begin at 11 a.m. I've heard very, very positive feedback on how it's going out there today, so I'm really proud of that. But I do want to remind everyone that we may have inclement weather coming this evening, and that said, it could cause delays because the people are out with their iPads, and so there's sprinkling, water getting on the iPad, so it may be a little slower than what we anticipate, but we just ask you for patience and know that we do not plan on canceling the drive, so we do plan on continuing on and just weather through the inclement weather. Let's see, as I said before, both of these clinics are at Richard Borchard Fairgrounds at 1213 Terry Shamsey Boulevard in Robstown. I also want to remind everyone that although we anticipate receiving all of the second doses on schedule, your second dose does not have to be given exactly 28 days after you've had your first dose. In fact, you can wait up to 6 weeks after your first dose. But like I said, we do anticipate getting them, but I know we get antsy thinking, it's been an exact 30 days and no one's called. So just please know that we're absolutely doing everything we can. And again, we are waiting to get word from the state to see what we're going to get and when. But if we happen to miss that your exact 30 days or 28 days, it's okay. All second dose vaccines distributed will also be Moderna. Next, I'd like to talk about future vaccine drives at American Bank Center. The City County Health District will be alternating locations between American Bank Center and the Robstown Fairgrounds every other week. So we are hoping to have the next vaccine clinic at American Bank Center hopefully next week, assuming we get our vaccinations. We're also hoping to increase the number for the American Bank Center from the 500 that we had the first time and the only time to hopefully 1,000. So that's the tentative plan right now. We're also, it's an exciting development in our vaccine location options because your city council and I, we know how important it is, and we do hear you, and we do want you to know that we are all planning to keep a location inside the city limits as far as the vaccine drive is concerned. I'd like to touch a little on our Saving Our Seniors homebound program, which has been very popular. We anticipate opening the phone line for this program next week. So if you recall, we said the program only functions when we have the vaccines. And the hotline is opened only until that number of slots is filled. So if we get 500 vaccines, we will announce that hopefully on Monday, and then the phone line will open up at a certain time until we fill those 500 slots, and then it'll close down. And we hope to do that weekly. We are looking to keep that program sustainable, and if we can add more manpower to it, we absolutely certainly would. But we want you to know it's still open, and this is for homebound senior citizens, anyone really that qualifies under 1A, 1B, who cannot otherwise leave their home to get the vaccination. Finally, I want to remind everyone that the program, although it is open, and we actually created this program, I know that there have been times where people have called my office and said, well, the phone line's not open. Well, it's not. As I said, it is only when we get the vaccinations in. But it is a program that is a live one. But we just cannot keep the line open. Otherwise, we create a very, very long list, and that would cause some impatience for people waiting for someone to come to them. Let's see here. To wrap up, I'd like to remind everyone that we are tracking on our website the number of vaccines that we've administered. And so if you go to cctexas.com/vaccine registration, you will see that number. And so far, we have vaccinated 55,380 people. And that's just through our health district. And this number is just very important. It's a milestone for our region. This number helps us just see the path through this pandemic and moving on to getting past it and with our lives. This week alone, 14,000 people are expected to receive either a first or second dose vaccination. So that's a huge number. We know that obviously doesn't include everyone. We continue to work hard, and we ask you again for patience, but we do encourage you, if you have any questions, to please call the 826-7200, and we are very, very happy to answer whatever questions you may have that you're not certain of. So with that, I will allow Gabby to give us a brief Spanish translation, and then we'll hear from our Health Director, Annette Rodriguez.
Primero quiero agradecer al Hospital Infantil Driscoll al llevar a cabo una clínica de vacunación para más personas en nuestra área. Su próxima clínica va a ser el día de mañana. El tiempo de registro para esta clínica ya ha cerrado. En cuanto a las clínicas realizadas por el Distrito de Salud, ayer se realizó la administración de 3,000 vacunas en el Centro de Exposición Richard Borchardt para primera dosis. Entre hoy y mañana se van a llevar a cabo más clínicas para segunda dosis. Anticipamos llevar a cabo la clínica de segunda dosis lo mejor posible. Recuerde que usted puede recibir la vacuna entre 28 a 42 días después de la primera dosis. Las vacunas de la segunda dosis son de la farmacéutica Moderna. Para que las clínicas futuras, esperamos alternar sitios de vacunación, una semana en el Centro de Exposición Richard Borchardt en Robestown y la siguiente semana en el American Bank Center, esperando también aumentar el número de vacunas a 1,000 por cada ocasión. En cuanto a nuestro programa para adultos mayores confinados en su hogar o SOS, anticipamos tener la línea telefónica abierta la próxima semana en lo que intentamos obtener más vacunas. Recuerde, el número solo trabaja cuando hay espacios disponibles. La información en cuanto a la administración de vacunas la puede encontrar en nuestro portal de internet a la dirección www.cctexas.com/vaccine registration. A la fecha se han administrado más de 55,380 vacunas a través del Distrito de Salud y otros proveedores. Tan solo esta semana se espera que 14,000 personas reciban una primera o segunda dosis de vacunación. Queremos agradecer toda su paciencia en lo que llevamos a cabo este reto de vacunación y si cuenta con preguntas, llame al Distrito de Salud al número 826-7200.
Thank you. Annette Rodriguez, Health Director. I'm going to go ahead and start with the Nueces County COVID-19 statistics. So the first slide you see here, you see for the last 2 weeks all of the cases by day. And this is a really interesting slide right now because if you cut that right in half, right there between February the 3rd and February the 4th, For the first week, or the last week is the way I'm going to say it, might be easier to understand, 1,202 cases for that 1 week for 7 days. This current week, you can tell by the numbers. You see 109, you see 42, you see 86 cases one day. And so we did get down back to the double digits. We just need to stay there. 771 cases for the second week. So we are seeing a downward trend. It's also happening nationally. We're seeing a 20% decline. So that's good news for all of us. Next slide, please. This is the pie diagram where you see the recovered people. 33,467 people have recovered from COVID-19 in Nueces County. But you also see active cases are still above 2,000. 2,406 people still actively have COVID-19 in Nueces County. And then you see 673 deaths for a total of 36,546 cases of COVID-19 since we started back in March of 2020. Next slide. This is the hospitalizations, and if you look to my far right, you see that the high number was 167 hospitalizations 2 weeks ago. Now you see we've dropped down, and you can see the decline across the board. 147 hospitalizations today. Remember, that number is still very high for our hospitals that are having to treat these COVID-19 patients. They're having to don up, they're having to doff every time they go in and out of these patients' room. So it's still a lot of work for our hospitals, so we need to continue to work to decrease that number. Next slide, please. These are our ICU patients. These are patients that have COVID-19, but they're more critical. And so what you see in the far right is you see 61 over there. After the 246s, we jumped up to 61. We kind of stayed high, looked like we were plateauing, but the number looks like it's still coming down. So we're at 49, 49, 51, 49 people in the ICU. The number coming down is not always a good thing. The number coming down sometimes indicates deaths that we've had from COVID-19 patients. Next slide. So how many total COVID-19 deaths have we had cumulative since the beginning of March? We've had a total of 673 lives that we've lost to COVID-19. Today we had 2 deaths, 2 males, one in their 60s and one in their 80s. My heart goes out to those family members that continue every day to have to deal with the loss of a family member due to COVID-19. The 2 individuals today, they had diabetes, they had high blood pressure, and they had heart disease. Next slide, please. This is the final slide on the statistics. If you look at the far right, and you kind of break that into 2 weeks right in the middle, February 3rd and February 4th. Last week, we had 19 deaths due to COVID-19, and this week we've had 12 COVID deaths. So again, you are starting to see a little bit of a decline, but we need to continue to drive those numbers down so that we're not seeing deaths from COVID-19. So I'm going to switch over to what we've been doing and what we've been hearing at the Health District. So where are we today in terms of the pandemic? It's been just over a year since the world began to realize this pandemic was upon all of us. We have gone from too little information to an overwhelming amount of information to conflicting information. As we look back, we know now it's because the virus is like no other that we have ever experienced. And we are all doing everything we can to stay healthy and even alive. The most difficult thing about a new virus is just that. It's new. Therefore, we don't have history to be able to help us with all of our decision-making that needs to be made. That's why the entire world's health experts are working on this tirelessly. We need data, and we need it quickly. And then we make decisions based on the ever-changing scientific data. So what do you need to know to keep yourself and your loved ones healthy? And what current information is out there? Today, I just wanted to highlight some of the current information we do know. Vaccinations. We finally have vaccinations. They are necessary because we want to slow the cases down. And if someone does get COVID-19 after they've been vaccinated, we want the disease to be less severe for them and thereby avoiding hospitalizations. Yes, there will be exceptions to the rule, but we are already seeing promising results. Los Angeles was in a dire place very recently, but reports are showing that they have had some very promising results after getting vaccines into the community and to continue to follow the public health strategies. We do not want a surge to occur here, nor for the virus to mutate further. Another really important thing about getting vaccinated, as soon as you're eligible and as soon as vaccines are available, is that you are vaccinated and thereby you protect others from getting the virus by protecting yourself. You have heard from others here today about vaccinations, the different locations, and the times. And so, again, we want to remind you, you can always go to our website, cdctexas.com/coronavirus for more information. Mutations. The 3 variants from UK, from South Africa, and from Brazil are all in the United States right now. Again, this is very new, and there's not enough data or history to have a clear impact on how infectious they are or how lethal they are. And even if the vaccines we are currently given will continue to protect us long term. Right now, we are in a race against the spread of the mutations in hopes that we can get enough people vaccinated and thereby protecting others from getting the virus. CDC is monitoring these variants and gives us updates as well. It's an ever-changing situation, and as we find out new things about it, we will share that information with you. Physical distancing. Just because we have started vaccinating in our community doesn't mean we are in the pre-pandemic phase of our lives. We are far from that point. In some ways, we are in a more tricky situation than we were during the summer peaks, giving us a false sense of safety with the vaccine. We understand that many people have pandemic fatigue. However, we need to continue to be patient and be diligent. The rules are starting to feel like something we don't want to listen to anymore, but pay particular attention to these. These rules are more important than ever. Always remember, it's a team's commitment that will help navigate us out of this mess, not individuals on their own. You are either part of the solution or you become part of the problem. We all want to solve this as soon as possible, and we can as a team. Solidarity during pandemics are key to success. Wearing a mask, keeping your distance from others, and washing your hands as often as possible is still extremely important. And lastly, I'm going to talk about the long haulers. This term refers to people that have gotten COVID-19 and for weeks, and sometimes even months, and sometimes even longer, continue to feel run down and sick. But we do not have enough information on long-term data. But more and more we see people who get COVID-19 and seemingly recovered, and later they start showing various symptoms for many, many weeks and months. The symptoms vary from extreme fatigue to organ issues to less debilitating, but still gives long-term symptoms that are still being studied. This is yet another reminder that there is still a lot to learn about this virus. So please do everything you know about disease transmission to keep yourself and your loved ones from getting it in the first place. I'm going to now turn it over to Gabby for Spanish translation. Thank you.
En las últimas 24 horas se han reportado 102 casos confirmados por el coronavirus, más de 700 casos en la última semana. 33,467 pacientes se han recuperado por completo, 147 continúan en el hospital. Afortunadamente, las hospitalizaciones continúan declinando. 49 personas están en la unidad de cuidados intensivos, 2,406 son casos aún activos. Hoy se reportan 2 fallecimientos. A la fecha, los fallecimientos totalizan 673 personas en el condado de Nueces. 12 fallecimientos esta semana comparados a 19 la semana pasada. Hace un año que comenzó esta pandemia. Hemos pasado de poca información a mucha información e información conflictiva durante este tiempo, pero hacemos lo posible por mantenernos con salud. Lo más difícil es que es un virus nuevo. Lo que sí sabemos y quiero compartir es lo siguiente. Primero, las vacunas. Las vacunas son necesarias ya que si una persona contrae el virus, evitará una hospitalización. Habrá casos excepcionales, pero hemos visto buena respuesta en otras comunidades. Segundo, en cuanto a las mutaciones o variantes del virus, las 3 variantes del Reino Unido, Brasil y Sudáfrica están todas en los Estados Unidos. Esperamos que las vacunas actuales continúen protegiéndonos. Los Centros de Control de Enfermedades monitorean las variantes para actualizar toda la información y las vacunas. Tercero, el distanciamiento físico. Sabemos que la gente está cansada, pero debemos continuar tomando todas las medidas de prevención ya que estamos lejos de que esta pandemia termine. Cuarto, las personas que continúan teniendo secuelas por largo tiempo. Desafortunadamente, aún no contamos con suficientes datos. Algunas personas que contrajeron el virus y se veían recuperadas regresan a mostrar síntomas. Esos casos se están estudiando para poder obtener respuestas, por lo que le pedimos haga todo lo que esté de su parte para evitar contagiarse.
Thank you. So second dose clinics. Second dose clinics for 9,000 citizens that were vaccinated with their first doses on January 11th or 12th or on January 15th or 16th. Some received their second doses today, and the rest of them will receive their second dose vaccine tomorrow between 11 a.m. and 7 p.m. We reverse alerted everyone last night to give you your appointment time as well as your password to get into the clinic. Please write your password when you get it boldly on a piece of paper and display it on the dashboard or on the windshield or hang it on the rearview mirror so we can easily see it as you're coming into our clinic. So I wanted to say thank you. So many people came through today and they were just so grateful for getting their second vaccine. We got cards from a lot of people, but I have to read you this one. This just says, "You're the best." And it says, "Dear volunteers, medical staff, Corpus Christi Health Department, and all involved. Thank you so much for everything and all your hard work day in and day out. My heart condition means I'd only have a 60% chance of survival if I got COVID-19. So thank you because you have all saved my life." So that says it all. So I just wanted to make sure to say thank you to them for coming and for getting vaccinated today.
Tendremos clínicas de segunda dosis para más de las 9,000 personas que recibieron la primera dosis los días 11, 12, 15 o 16 de enero. Esas personas recibieron ya una notificación con una cita y una contraseña.
Okay, and finally, we're going to end with some questions and answers because the phone banks are ringing still off the wall with a lot of questions. So I'll read it in English and give you the answer, and then Gabby will translate it in Spanish. So here are the questions we've been receiving. Can I change my appointment time? The answer is no. Please come as close to your appointment time as possible. We are doing everything possible to get these second doses in your arms as quickly as possible. Please do your part to keep your appointment time.
¿Puedo cambiar la hora de mi cita? No. Llegue lo más cercano a la hora de su cita. Le pedimos haga de su parte para poder mantener bien la coordinación.
Can I change my appointment day? The answer is no. Please come in on the day of your appointment. These second doses just arrived yesterday around 10:20 in the morning, and we already set up the clinics for today and tomorrow. Remember, we have many different logistical concerns we have to watch every day to get these clinics set up, including, like the mayor said, the weather, and just be mindful that my staff is outside in these elements.
¿Puedo cambiar el día de mi cita? No. Por favor, venga el día de su cita. Estas segundas dosis llegaron ayer alrededor de las 10:20 de la mañana y ya configuramos las clínicas para el día de hoy y mañana.
Question, can I get my first dose tomorrow at the second dose clinic? The answer is no. Well, we heard that you had 9,000 doses. These doses are specifically for those individuals that had their first doses the week of January the 11th.
¿Puedo obtener mi primera dosis en la clínica de segunda dosis? No. Estos son específicamente para las personas que recibieron sus primeras dosis la semana del 11 de enero.
Can I give my second dose to another family member? I no longer need it. I actually picked up COVID-19. The answer is no. This is your second dose vaccine, and the only reason we're able to give 9,000 second doses in 2 days is because you are already registered in our system. So we're able to get all of your registration information out easily and quickly for this second dose clinic.
¿Puedo darle mi segunda dosis a otro miembro de la familia? No, esta es su segunda vacuna y la única razón por la que podemos administrar la segunda dosis es porque ya está registrado a través de nuestro sistema.
Question, what is the magic link? The magic link is for second dose recipients. The reason it's called a magic link is because when you click on it, it has all the information on it about you that you gave us when you registered. So you don't have to rewrite your name, your address, your date of birth. It's all there. That's why it's called the magic link.
¿Qué es el vínculo mágico? El vínculo mágico es para los receptores de la segunda dosis. La razón por la que se llama enlace mágico o vínculo mágico es porque cuando hace clic en él, tiene toda la información que nos proporcionó cuando se registró para la primera dosis.
Question, does everyone get a magic link? The answer is no. Only people that need their second dose from us will get a magic link, and only people that register online. So if you registered by calling our phone banks or our hotline number, you will not get a magic link and you will not get a QR code.
¿Todos obtienen un vínculo mágico? No, solo las personas que necesitan su segunda dosis de nuestra parte y solo las personas que se registran en línea. Si se registra por teléfono, actualmente no obtiene un vínculo mágico o código de respuesta rápida.
Question, is a magic link the same as a reverse alert? No. The magic link is a text message, an SMS, if you will. So if you only have a landline, you will not receive your magic link. A reverse alert gets sent out both through text message and you can get it on your landline phone. The reverse alert will call your landline and give you your password you need to get into the clinic.
¿Es un vínculo mágico lo mismo que una alerta inversa? No. El vínculo mágico es un mensaje de texto, por lo que si solo tiene un teléfono fijo, no obtendrá su enlace mágico. Una alerta inversa se envía como mensaje de texto y como llamada telefónica.
Question, if I don't get the magic link, can I still get my second dose? Yes, of course. We will find you in our system with your name and date of birth, so you will be fine. It's just much faster if you do have a QR code that when you bring it in to the clinic, we can find your information that much quicker.
Si no obtengo el enlace mágico, ¿puede recibir mi segunda dosis? Sí, absolutamente. Podemos encontrarlo en nuestro sistema, con su nombre y fecha de nacimiento, así que estará bien. Es mucho más rápido si tiene su código de respuesta rápida o QR code cuando viene a la clínica.
What if I miss all the notifications? What should I do? Call the Health District phone bank first thing in the morning tomorrow, and they can help to confirm the information for you. The number is 826-7200, option 2.
¿Qué pasa si pierdo todas las notificaciones? ¿Qué debo hacer? Llame al banco de teléfonos del Distrito de Salud al número 826-7200, opción 2, ya que su información puede ser corregida en el sistema.
Question, my vaccination card says I was supposed to get vaccinated on Monday the 8th. What should I do? Your card does say the 8th if you received it from us, the health district, but it says the 8th or after. You can get your Moderna vaccine, like the mayor said, anywhere from 24 days after your first dose up until 6 weeks after your first dose. But please do your best to get it as near the vaccination date as possible, but don't worry if it's just a few weeks later. You should still get the 94% protection after the second vaccine. Remember, we're in a pandemic, so we get vaccines when the state has enough to send them to us.
Mi tarjeta de vacunación dice que se suponía que debía vacunarme el lunes 8. ¿Qué debo hacer? Su tarjeta dice el 8 o después. Puede recibir su vacuna Moderna desde 24 días después de su primera dosis hasta 6 semanas después de su primera dosis, pero haga todo lo posible para que esté lo más cerca posible de la fecha de vacunación.
The last question is, what if I received a Pfizer vaccine for my first dose, and it's now time for my second dose? Can I come tomorrow to the Richard Borchard Fairground to get that second dose? The answer is no. These second doses are all Moderna vaccines, and they are specific for the people that received their first Moderna vaccine from us the week of January the 11th.
¿Qué pasa si obtuve Pfizer para mi primera dosis y ahora es momento de mi segunda dosis? ¿Puedo venir mañana al centro Richard Borchardt? No, estas segundas dosis son para vacunas de Moderna y son específicas para las personas que recibieron sus primeras dosis de la vacuna Moderna la semana del 11 de enero.
I hope to see all of you tomorrow receiving your second dose at the fairgrounds between 11 and 7 p.m. Remember to stay safe, stay vigilant, and as always, stay informed. Thank you. This now concludes our presser, and there's no questions, so we will see you back next Tuesday at 5 p.m. Thank you.